Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. Today's guest, Dr. Susan Blum, without question shared some tremendous insights on arthritis. She's going to show you her three-step plan from her book on how to heal arthritis. The whole idea, the systemic idea of upstream and downstream, without question, this is a must listen to. Hey everybody, Dr. Rob Silverman here, Proven Health Alternatives. I have my esteemed colleague, Dr. Susan Blum. Dr. Blum, how are you today?
I am excellent. How are you this morning, Rob?
Couldn't be better, couldn't be better. Now you're an MD, MPH, and
Yes.
you have a great bio that we're gonna add at the bottom. You've been practicing medicine for X amount of years, and now you practice something it's called functional medicine.
That's
Everybody
correct.
wants to know, with your medical background, how you got to where you are now.
Okay, great. And so let's see, I started in conventional medicine, and I appreciate that you said X number of years because, we don't need to give away how old I am, but I will say that I've been practicing functional medicine since 2001. I sort of started looking outside the box. So I started out in internal medicine, like a lot of people, conventionally trained. And I actually became very interested in understanding how people got sick and what you could do about it. Rather than, in functional medicine, we call it upstream and downstream medicine. And so I'm in the hospital doing all my training, and this is very far downstream, right? So this is symptoms, sick, disease. We think of upstream as backing up and trying to figure out how someone got there, which in functional medicine we call figuring out the antecedents, like what teed them up, the triggers and the mediators, like what's keeping them sick, what triggered what happened. And so in the conventional world, the only place for me to turn was the field of preventive medicine. That's really was what the conventional medicine world could sort of offer for someone interested in nutrition, in stress, in understanding how all those factors. And so I went to Columbia and I did my master's in public health, thinking I'd find it there. The real primary prevention, like how do you go way upstream? Preventive medicine conventionally is early detection, mammograms, immunizations, that's really what the world of prevention really has typically been. And but really going beyond that and going to primary prevention, you've got to look at food and stress and exercise, lifestyle medicine. And there was no place for me to study that back when. And so I discovered the Center for Mind-Body Medicine in 1998, which is really about stress and understanding how stress causes disease and what you could do about it. And then I ended up at the Institute for Functional Medicine in 2001, where I did my training. And actually, when I went to that main immersion training, I felt like I won the lottery because I finally figured out this is how I want to practice medicine. It's all about figuring out what is triggering your symptoms. And it doesn't have to be, you don't have to find a diagnosis to figure out what's triggering your symptoms. You have to just dig in to different systems of the body and assess functioning. And then once you sort of identify where those imbalances are, you treat the dysfunction and people get better.
Outstanding. So, well, as we all know, functional medicine is treating the system, not the symptom. As you said, there's only 12 to 14 systems, depending on who you talk to. But it's all based, like you said, at root cause resolution. So you were
Right.
searching for that. That's fabulous.
So I was one of the first people out of the gate, really, because when I did my functional medicine training, it was like this many people in the room. Now there's 800 people at the trainings, and it's become a movement, which is really very exciting. But really what I have to offer at this point, what I've learned, my experience. I'm almost 20 years of practice. And so, where a lot of times we're always talking about quick fixes, people go online and there's a 30-day this and a 6-week this. And believe me, I do that too, but that's just the beginning. That's sort of the therapeutic phase, sort of the jump start, get yourself on track. But I know, and because you've been doing this probably almost as long as me, we have to work with people long-term, finish what you started. And how do you do that? How do you ensure the body continues to heal and go deeper and get itself on track and stay there?
Outstanding. Yeah, fix the body from the inside out. I love it.
Yeah,
Now,
inside out. I know that's
that's my
a
thing.
Rob Silverman thing. Yeah.
That's my thing. Now, you wrote a book. You had your first book, which is still in print, doing great.
Oh yeah, that's the immune system recovery plan.
Mhm.
So what happened was, after about 10 years of practicing functional medicine, I was, the autoimmune epidemic really, hit stride about 10 years ago. And since then, the numbers have just been staggering. And in functional medicine, who do we see? Who started coming to see me? People that are either complex chronic disease, they have a diagnosis, no one's helping them feel better, they've gone to every doctor, their medicine's not working, or they want a different alternative to medicine. But people who are really sick started to come see me, a lot of autoimmune people. And in addition to really sick people, I also get a lot of people with just hormone imbalance and want a good look under the hood and good prevention, so it's the whole gamut. But us functional medicine folks are great at those tough cases is sort of who ends up coming to see us. And certainly, as a physician, I get a lot of rheumatology, right, which is autoimmunity. And so I started treating a lot of autoimmune people, and I was diagnosed myself with Hashimoto's right around this time. And I took what I learned in functional medicine and I applied it to myself, and I cured myself of my autoimmunity. And I started using what I learned to really work with all of my patients, and they all were getting better. And I realized somewhere around 2012 or 2013 that the public, nobody knows. People don't realize that actually you have an option. There is something you can do to heal autoimmune disease, and not just go to a rheumatologist and take medication, to suppress your immune system. And so I really felt a real urgency to get the word out that there is something you can do, and there is a simple 4-step program for how to do it. Go to all the root places, food, stress, gut health, detox, and infections, to really look at all those triggers and treat all the triggers. And so I wrote a really great how-to book called The Immune System Recovery Plan. And actually that's been a bestseller ever since. And so I see a lot of autoimmune people because they, I've written the book, and so they all come to find me. And I offer a lot of online programs, so anybody from anywhere can get help making their way through the book. And so autoimmune is really important. What I discovered, okay, go ahead, you.
No, I'm sorry. I wanted to say I read the book. It was a great book. And I wanted to segue that autoimmunity, because I know you know where I'm going, to this new book that you wrote about arthritis.
Correct.
So,
that's what I was going to.
Book on arthriafthritis.
That's exactly it. So we were both you and I are always on the same wavelength. So power of mind. So I wrote the book on autoimmunity, and what I noticed was I was seeing a lot of arthritis people, rheumatoid arthritis, psoriatic. Arthritis is a common symptom and issue for people with autoimmunity, whether it's an autoimmune arthritis condition like rheumatoid, psoriatic arthritis, ankylosing spondylitis, and there's a whole grouping of inflammatory arthritis conditions that go with autoimmune disease too, like Sjogren's or lupus. Like, people can also get arthritis. So I was seeing just tons of autoimmunity with arthritis, and what I noticed was that the people, as I'm doing all my work with them, parallel to the fact I was seeing so much arthritis, there was so much work coming out and so much research, as you know, on the gut microbiome. Now, back in whenever it was, I did almost 20 years ago, when I did my functional medicine training, I had already learned about the gut microbiome. We were doing the gut repair program. It came out of the world of naturopaths and chiropractors, and like everybody was talking about gut back in 2001, when I did my training. And so I was already working on gut repair. But then about 10 years ago, I'd say after 2010, there's been an explosion of research showing the importance of the gut microbiome, not only in inflammatory diseases in general, but specifically the association of alterations in the gut microbiome and leaky gut with rheumatoid arthritis, all the inflammatory autoimmune arthritis conditions. And I thought, well, dang, I got to tell now the next story, which is, look at this gut arthritis connection. It's tremendous, as well as the sort of the gut inflammation connection. And there was so much research on it and the importance of a healthy gut microbiome that I decided that should be that's the next word and information that I need to get out there about this connection, because people didn't really, it was not being talked about as just a common, understandable, a known thing. And so that's what inspired me to write the next book. And with that book, which is what we were going to talk about, arthritis today, it's really what I learned, and which is so important, because not only did I dig into the inflammatory arthritis conditions, but I also looked at every kind of arthritis, because a lot of people think that osteoarthritis, which is so common, everybody expects they're going to get arthritis someday from, wear and tear in their joints. And what the research showed me, and what I learned I knew from my practice, and I wanted to share, was that you might have some wear and tear, but the pain of arthritis, talking about just osteoarthritis now, is not inevitable. The amount of pain you have depends on the amount of inflammation in your body, because inflammation that's zipping around your whole body, which is systemic, lands in the joints and gives you pain. And so the importance of understanding understanding where inflammation comes from is important, no matter what kind of arthritis you have. And so there is still that gut connection for people with osteoarthritis, but there's other triggers too, which we'll get into. But learning all this and understanding how to reduce inflammation through all the gut work I was doing and through all the autoimmune work I was doing, I felt it was really important to get the word out to all arthritis sufferers, that there is something that they can do to help reduce their pain from a functional perspective.
That's such a great approach, because it's about 23% of Americans suffer from arthritis, a little more heavily pointed towards women than men. They expect an expansion, et cetera. Very high in the U.S.
Yeah.
So
it's worldwide. It's an issue worldwide too, as you know. Yeah.
Absolutely. So there's different kinds of arthritis. So you want to dive them a little for everybody, because
sure.
And go back to what's the core between the 2 or 3 or 4 that you want to talk about.
Absolutely. And so, so here are the big buckets. I mean, the biggest 2 buckets are inflammatory arthritis, which is more on the autoimmune kind of spectrum, right? So that's rheumatoid, psoriatic, ankylosing spondylitis, arthritis from autoimmune diseases. And then there's something called seronegative, rheumatoid arthritis, or inflammatory arthritis without positive labs, but people will tell you, oh, you're going to have rheumatoid arthritis someday, right? So there's that whole bucket. The second huge bucket is osteoarthritis, which I mentioned just before, in terms of wear and tear. And you can differentiate those two, not only with laboratory values, but looking at an x-ray. Like, x-rays are a great way to figure out what kind of arthritis you have. They look completely different on the x-ray. The next big buckets that are really important are gout, right? And gout is very interesting in that usually a blood test, and it's the big toe, the base of your big toes or the thumb. And so there's certain joints, it's actually easy to diagnose if this is gout. And so gout is another big one, but really important in my practice, and anyone really living anywhere now, is to rule out any kind of infectious arthritis or reaction from an infection. So where I live, so I go through this whole thing. You want to rule out gout, and you want to make sure there's no infection. And so Lyme disease is just an epidemic. I live in the Northeast. I'm in New York. And so everybody, gets a Lyme test in my office. And, especially if you present with arthritis, Lyme tends to be the bigger joints, like the knees and the hips, as opposed to the inflammatory arthritis conditions like rheumatoid, are the smaller, like the fingers and toes. Osteoarthritis, can be everything. It can be any joint. But so there's some ways you can try to get a sense of it. People with Lyme disease tend to also have other symptoms, like extreme fatigue. Sometimes there's neurologic symptoms like tingling, numbness. And so you can sort of suss that out a little bit, but everyone gets a Lyme test. You need to do a Western blot. If I'm really suspicious, I send it to a special lab in California, Igenics. And so definitely you want to make sure you don't have Lyme. There's other infections like there's mycoplasma pneumonia. There's infections that I test for. So that's like blood work, mycoplasma. There's other infections like parvovirus and, self-limiting viral conditions. Sometimes you can have a reactive arthritis that's after you get a urinary tract infection. There's sort of things like that. So I think so for me, and I lay this all out in my book, you want to make sure you know what kind of arthritis you have, because you want to make sure that those treatable ones that are treated with antibiotics or other approaches, you want to rule those out and then just come back to the 2 main buckets, which is the whole inflammatory arthritis conditions and osteoarthritis. Does that make sense how I
No,
laid
that
that
makes a
out?
lot of sense.
Yeah.
That really
Because those two are the big chronic ones that you want to really work on. Lyme, you have to treat the Lyme, right? The other two, the osteoarthritis and the rheumatoid arthritis, I'll call that just that grouping. Those you need to go upstream and start looking for all the mediators and triggers and help people lower their systemic level of inflammation. Gout is a big lifestyle problem too, high uric acid levels. It's related to insulin resistance and diabetes and too much body fat and your diet, right? So there's an additional piece to gout that needs to be addressed. But the first two categories, those are the big ones that we talk about in terms of really working on the upstream sort of functional mediators and triggers.
Excellent. And the gut plays what role in all this?
Well, the important thing about the gut plays a role in really everything, right? So for the inflammatory category, the gut is central, right? And so in my in the program that I outlined in my arthritis book, I actually give people 2 solid months of herbs for treating the gut microbiome. It's really a week, there's the quick fixes. That might still sound like a quick fix, 2 months, but so for some people it might sound really long, but it's that important. You need to do the gut, remove the harmful overgrowth of potential microbes like bad bacteria, yeast, parasites. You need to identify what might be there and remove all that and clean it out. I call it a good pruning of the garden. Like if you think about your gut microbiome as flowers and like a beautiful inner garden, think of these things as weeds that can take over the garden. And so we need to do some weed killer, like removing the weeds for a couple of months. So I really have a big gut focus for sure on people with the inflammatory arthritis, because there's so much research. I have a whole chapter of the book dedicated to reviewing the literature and all the studies showing not only the association of altered gut microbiome, we call it dysbiosis, and inflammatory diseases and rheumatoid and these kinds of arthritis, but researchers have actually figured out the mechanism by which people get inflamed joints from dysbiosis in the gut. And what happens is the weeds in the garden, they damage the tight junctions, we call it, the intestinal lining, which is supposed to be a barrier. These harmful microbes actually sort of destroy the gates, and so you get spaces in the intestinal lining. And not only does food and particles of whatever you're eating slip into the body through this lining then, but actually the bacteria itself, pieces of the bacteria slip into the body. And as these pieces of bacteria, we call them bacterial cell wall components. And another name for that is lipopolysaccharide, which is the cell wall components of these bad bacteria. There are a whole grouping of bacteria called gram-negative rods, and they have just irritating compounds on their surfaces. And when they slip into the body, they trigger a whole inflammatory reaction. And researchers have actually found pieces of the bacteria cell wall inside the joints of people with rheumatoid arthritis. And so there's been a lot of research looking at the mechanism and proving that this whole process of imbalanced microbiome with dysbiosis, leaky gut, which is this increased permeability, and how that ends up with inflammation in the joints. And so from a functional perspective, so I lay that all out in the book for sure, but it's really important to then say, okay, what are we going to do about that? And so by heading upstream, you've got these inflamed joints, you've got to head upstream and say, now I need to repair the gut if some of the inflammation is coming from there. And so how do we repair the gut? We repair the gut by removing those bad bacteria or yeast or whatever's causing the leaky gut. We remove foods that might be triggering and damaging the gut. We replace digestive enzymes in case we need them. Like that, we start repairing the functioning of the gut, because then you go even further upstream and say, how did the gut get there, right? What caused it to be out of balance? And that's really important for long-term repair, right? Because at the end of the day, you have to figure out how you got here, right? And for some people, it could be chronic stress. For some people, it could be taking too many antibiotics. For some people, they could be popping Tums and proton pump, taking antacids, and you have to stop all those bad behaviors. For some people, it's their diet. That's too much sugar. They've been encouraging yeast overgrowth. For some people, they've been on certain medication. And so you have to really help figure out, chronic constipation will cause bacteria to pile up and overgrow. And so you have to really even go beyond the quick, treat the dysbiosis, help them with enzymes and function and motility, repairing the intestinal lining. You have to do all of that. But then you really have to even go further upstream to the behaviors or the things that got the gut out of balance in the first place. And so there's a lot of work to do, right? But the gut repair is really important. And I want to just end this answer by adding that even though there's so much research associating the gut and inflammatory autoimmune arthritis conditions, the gut is also driving inflammation into joints of people with osteoarthritis. So just because I didn't mention you in the research, the osteoarthritis folks that are listening, if you've got digestive symptoms, and a lot of times people have this problem, this leaky gut issue, even without any you might have no symptoms and you still have a leaky gut. Helping make sure you have a healthy gut microbiome is going to be critical as a foundation for finding all the root causes of your inflammation. And so even the osteoarthritis folks have to pay attention and treat their gut and make sure it's healthy.
So, wow, there's a lot to synthesize.
Sorry.
No, it's great. It's great because we are speaking the same language. Leaky gut. You really gave a great dissertation about LPS, releasing the gram-negative bacteria, if you will, posing that antigen, tight junctions, hold those gates, like you said. Once it gets past your gut, whatever goes, passes your gut goes into your bloodstream, so you can have systemic inflammation, localized inflammation, ultimately autoimmunity. So a lot of what you're doing is stopping it, you're keeping the barrier intact. Interesting. You're talking about your book, which we read, the arthritis book. You have that 3-step program. Please, for everybody, delineate those 3 steps that everybody.
Yes, I will be happy to do that. So the 3 steps. And this is from practicing medicine for so long and realizing the importance of, and practicing functional medicine for so long, I crafted these 3 steps differently than the first book, because what I did was the step 3, so it's food, and then it's heal the gut, and then it's finish what you started, right? Because I felt it was really important to help people understand that we're doing an intense therapeutic plan, and it's going to take about 2 to 3 months. But then, because we're going to work on food, and that's removing, I call it the leaky gut diet for arthritis, right? So it's removing a whole list of foods, which in a way are just the classic gluten, dairy, soy, corn, eggs, sugar, and then the nightshade vegetables, tomatoes, potatoes, eggplant, and peppers. I also, and that's the base where everybody starts. I also explain to people if in some circumstances, people might want to be more restrictive for a little while. Like, there's the whole conundrum about, do I eat lectins? Do I take out all grains? And so for some people with really severe rheumatoid arthritis, or they know that they've got a really bad gut, they've been a lifelong person who've had stomach issues or digestive issues, IBS diagnosed for a long time, you might want to or need to take those foods out too, which I give you instructions for doing that. For people who suspect they have SIBO, small intestinal bacterial overgrowth, I explain what that is, and the diet, they can tweak it for themselves. But my baseline is just that basic, because I would say for 3/4 of everybody reading the book or coming through my programs, that is a good place to start. Not everybody needs to be super restrictive or pull other foods out. But some people do, and I help them do that too. So there's this jump. So for the first couple of weeks, we get people settled into the food plan, right? And we start talking about stress and mindfulness and why that's important, because that damages the gut, in addition to how food can damage the gut. And then we move into the gut healing phase, and that's 2 solid months of gut repair work. And during that time, we're treating the dysbiosis, we're healing the leaky gut, and we're talking about all the ways in which, helping you understand how you got there, right? And behaviors that you need to work on to make sure this doesn't keep happening. And then the next step, which is the Finish What You Started 6-month program. And I think that that's actually, when I ever have the opportunity, that's what I like to talk about these days, because my colleagues and my friends, like, we all do our therapeutic plans. We all know how to do this repair program. We've been doing it. It's the 5R gut repair program from functional medicine. It's like dogma. We've all taught it 20 years now, right? But the problem is, and actually at IFM, I don't remember when they added the 5th R, but I learned the 4 Rs. And I think that as we're all aging and practicing, at IFM, which is the Institute for Functional Medicine, a 5th R got added in the past 5 years or so, maybe longer. I don't know. Time goes so fast. But the 5th one is called Retain, which is really what I'm talking about, which is, finish what you started. How do you retain? And so it's a conversation about the ecosystem. And this is where I want to pause for a second and just slow it down and make it very clear that I'm humbled by the gut ecosystem. We're all humbled. There's so much research, but we still don't know nothing. Okay. And I'm saying that with all due respect to you and everybody. We think we know everything. We don't. Okay. We know a lot more than we knew, but the gut is an ecosystem. It's not like in conventional medicine world, we think you just give an antibiotic and you treat it. Like 1=1, it's like a 1-to-1 ratio or something. Like you just do it and it's fixed. It doesn't work that way. An ecosystem has to do with balance and the terrain, the soil. How do you make the gut more hospitable to the good stuff? How do you stay there? How do you create an environment in your gut that will help you grow those flowers and help you keep growing those flowers and help you keep the inflammation down? And so I really focus a lot on talking about long-term, what's the long-term plan here? How are you going to stay here? Not just, we'll do this reboot and this 2-month program, great. And you'll feel better. But like, what comes next? And I think there's not enough conversation about what comes next. Not just about like supplements and like in gut healing, but in the food. What happens after that therapeutic plan? Are you supposed to be on a lectin-free diet for the rest of your life, for goodness sake? Absolutely not. Like, that's not the way anybody should have to think they're going to eat, because people just blow up. They're like, I can't keep eating this way. You shouldn't have to keep eating this way. As you heal your gut and as you get better, you can start eating more foods. And so I spend a lot of time talking about the research on what's a good long-term way to eat, right? What's the goal? Where do you want to go once you're feeling better? And I'll put forth that from my research, and in the book, there's a whole section on the best diets, the best food plans for a healthy gut microbiome. So if the goal is then, if we all agree that a healthy gut is the goal and it's going to treat you, it's also a healthy gut will help prevent illness going forward. And so you want to eat in a way that supports a healthy gut. And what are those food plans? That's the Mediterranean diet and vegan and vegetarian ways of eating. There's very good research on this. It's not eating 70% animal. It's not eating 70% fat. That's not a long-term plan. It might be what you need to do for a couple of months as a healing or for specific health conditions. Those are therapeutic ways to eat. I'm with you. But long-term, you need fiber, you need plants, you need polyphenols, all those colors. They are influencers on the gut microbiome. The polyphenols, which are all those colors like resveratrol and EGCG, all the lutein, all those antioxidants, they're called polyphenols. They actually influence the expression of the genes in the gut, in the bacteria in your gut, and they help them function better. And so you want to give polyphenol, and the Mediterranean diet is filled with polyphenols and fiber. And so you really need to eat a lot of plants. So I'm not saying you need to be vegan or vegetarian, but I tell people then look at the Mediterranean diet's just fine, right? It's mostly plants, but there's there's fish, there's a little bit of animal, there's a little bit of dairy if you tolerate it at some point, a little Parmesan cheese here and there, it's balanced, tons of legumes, tons of olive oil, tons of, there's nuts and seeds, there's vegetables, and there's whole grains. And so it's all about balance and helping people know, don't despair. You're not going to have to eat this restrictive food plan forever. Long term, this is where we're going to help you go. And I think it helps people with optimism and knowing that there's, that there's something that they know they're not going to have to sort of live this way forever.
Oh, I agree. And it was great. I mean, I agree with you. I think the microbiome is the crux. There is not a scintilla of doubt that it is. We just don't know. We may know 2% of what we really need to know in the next 10 years. I concur. And in addition, what's really great is I agree with the Mediterranean is always ranked number one. Get to the plants. The heavier fat diet we were talking about, the keto, sort of an outstretch of Atkins, or Atkins took it from there. The literature is robust in a short period of time.
Right.
Because we also have
but it's not robust for a good gut microbiome, right?
Right.
So
no, it's neurodegenerative disease, brain fluid.
Yeah, and some people, right.
Right.
The only thing I'll say, you and I remember we spoke on a panel and we had a whole keto sort of conversation.
Right.
I do keto with people if they need it, but I will say that keto isn't necessarily great for the high risk cardiovascular people. And I just have to say that I'm seeing cholesterol go up from all the coconut. I think you just have to be really mindful. Coconut oil in some people, I've seen cholesterol go up 100 points, and all the quality of the particles change in a really bad way. And so I'm just very mindful. I choose who to give that to. I think it's important for people get advice about choosing that.
Right. That's not for everybody. And also there's the dirty versus the clean keto. They think that they're eating sausage because it's high in fat.
I like that. Dirty versus clean. I like that.
Dirty versus.
So in my dirty, I actually put coconut in the dirty part.
And
from my experience, I'm a little afraid of coconut oil these days.
It's going to be interesting because I think if we go to functional medicine, they'll say palm oil is dirty, coconut is good, but you may be right because coconut, the saturated fat is the conversation. And again, I know you do it also. We do a lot of gene testing. Somebody like me actually functions well on carbs, not as well on saturated fat. So every time I put the egg yolk, which everybody says is healthy, my markers change a little bit and I get a little body fat. So again, it gets to what you're really saying in the book is that individualization, that personalization. That's why
What gene testing are you doing? Like, what do you mean by gene testing?
Toolbox genomics. I'll tell you all about it. You'll love it.
Okay.
You'll love it. I do a blood test also for genes.
But are you talking about ApoE kind of ApoE?
ApoE and the cholesterol transporter. Thank God I was a 3 and not a 3-4 or 4-4.
Right, I'm a 3-3. But the ApoE4 people, I'm actually an ApoE3 too. So technically I should be okay with fat, right? The ApoE2, but yeah, I use that too. But the ApoE4 people, they should not be on a ketogenic diet.
No, not.
And so that's what I'm saying. Like, you have to really be mindful of that. And people with a high LPA, when you do their cholesterol testing too, those are the other genetic people,
Yeah, that's the genetic. More interesting with the ApoE, and I don't want to get off.
No, I know. But it's important for people to understand there's a foundation and why they should see someone before they put themselves, not all diets are good. If they try ketogenic and they see their cholesterol went up, not for you. I mean, if you don't want to have someone choose it for you, if you choose it for yourself, make sure you're following your cholesterol levels. We can leave. I just wanted to add that for your listeners, and then we can move on. At least they have something they could do with that themselves.
So, you know what? Last question before I'm going to ask you how they can get in touch with you. Obesity. 50% of Americans are overweight. Yeah. We know 50% of Americans in 2040 will be obese. Yeah. How is obesity in epigrammatic fashion a trigger?
Oh, I'm so glad. That was the other thing I wanted to talk about. So I'm glad that you brought that up. So we were talking about the gut. And the research is unbelievable. Is the research that's exploded on the osteoarthritis front is this connection between inflammation coming from the fat cells in the body and landing in the joints, right? And so osteoarthritis actually is now being considered and thought of as a metabolic disease. So it's associated with obesity, metabolic syndrome, diabetes, and it's not just because people are heavier and they're putting pressure on their knees. They always used to think like you lose weight and the knees feel better, and it's because of just the weight sitting on the knees. It's actually because you lose body fat. And so I know the name of all those chemicals that come out of the fat cells in the gut, and the researchers have, there's leptin and adiponectin, and there's these are called inflammatory cytokines, and they've actually measured high levels of these things, leptin especially, inside the joints of people with osteoarthritis. And so inflammation is systemic, as we keep saying, and the compounds that zip around the body and irritate places, right? Irritates every place. They're equal opportunity employer, right? It ends up in the brain, it ends up in the joints, it ends up everywhere. Fat cells, obesity is associated with osteoarthritis. So people with osteoarthritis, obesity will also, just like the gut crosses over into osteoarthritis, obesity will cross over into rheumatoid arthritis as well. Inflammation coming from the fat in your body is going to end up in your joints no matter what kind of arthritis you have. But there's just a lot of research now showing the connection between osteoarthritis. And so losing body fat is critical if you want to have less pain in your joints. It's just one of the really important triggers, and we call it a mediator. It's mediating in an ongoing way the inflammation inside the joints.
That's actually exciting for my chiropractic background. See so many people listening talk about joints.
Yes.
And I try and let them know, as you said, osteoarthritis is not wear and tear. It's the body's response to inflammation. The question is it systemic? Is it localized? Or is osteoarthritis really autoimmunity?
Right.
That's the real question. And it may be different cases, but I love the idea of talking about the obesity. For every pound you're overweight, it's 4 times the stress on your joint. So you're really putting together the mechanical problem and the biochemical problem.
Right.
And joint pain is just not as simple as, looking at your DOB on your driver's license. So a lot of great information. My question is, how can people get in touch with you and your work and, follow what you're doing?
Okay, excellent. So I am there's many ways. I have, you can go to my website, which is my website, blumhealthmd.com is my online platform where we do a lot of coaching and interaction. You could submit questions, contact us. You can join online programs. So that's my blumhealthmd.com. My bricks and mortar place is in Rye Brook, New York, and I have Blum Center for Health, and blumcenterforhealth.com has its own website as well. And so, you can go to either website, join our newsletter. You can, hear all about everything we're doing. And, between my books and the online programs and coming to see us, I think we are offering, my goal is to offer as many tiers of opportunity for people to get the information and what I've learned over the years.
Yeah. You're doing a great job, and it's been great chatting with you.
You too,
we
Rob.
have to do this again. We want to thank Dr. Susan Blum. And
Dr. Silverman, I've been calling you by your first name.
I love it. That's what listen, if I told you what my mom called me, we would both break up in laughter. So it's been my pleasure. I know all the listeners love what they are going to hear and are hearing. And I need to get you back on. I need to talk to you. And it's been my pleasure. Dr. Rob Silverman, Dr. Susan Blum.
Mine too.
Proven Health Alternatives.